We're going to start out with a guest that I've had on the show a couple times for ticker BIXT. All right. A ticker that is completely under the radar and undervalued, in my opinion, that has a very nice share structure. And I'm talking about none other than Mike Sheikh. Let's bring him in. Mike, welcome back to Buffalo Fireside Chats. How you doing, my friend?
Rock. Woo! Love the logo. It's awesome.
You know what? It's awesome. It is. I'm actually completely impressed. But you are literally Fireside right now. Where are you at, man?
Oh man, it's snowing out here. I'm in my condo in Breckenridge.
Nice.
It's beautiful out here. In the background, they're firing off bombs to get rid of the avalanche danger. So it's snowing. I might be stuck here for a while. Oh well.
Man, now you know what? I wanted to have you back on just to do an update. But last time we talked, it's always. There is so much that you bring to the table, especially in regards to galectin inhibitors and like the whole COVID-19 pandemic that happened and what you guys are offering at this point. But there's so much that we actually we don't cover. And so one of those things was an article that you recently you put out, and it's this article: the Galectin Antagonists send cancer to its knees, but who will strike the fatal blow? And I wanted to talk more about this article, and I'll put the link to it so you guys could click on it and read it. But I wanted to talk more about that because I think that there's a lot to be said, with cancer research and cancer treatments, and it sort of feels like we're at a standstill with treatments across the board. You know what I'm saying? Like we're still using chemotherapy, and then they're trying drugs or trying different things, but we're still using some of the same treatments that we've used for decades. So tell us a little bit about the article. I'm just going to give you the floor, and you could just say just tell us about the galectin inhibitors and the possible effect possibly on cancer.
Well, galectin inhibitors have gotten my attention for the past 20 years. And in the article, I talk about one of the drugs that it's actually was or is a competitor company made by Galectin Therapeutics. But back then, it was back in 2008, I had a chance to see an actual galectin inhibitor at work. What the idea behind that drug, it's called DAVANAT, and it's in the article, was that it was gonna encapsulate a chemo molecule, and then the galectin and the galectins are highly upregulated or surrounding on a tumor. So the idea is you take the chemotherapy molecule and it would be targeted right toward the tumor. And the company had really good results, but I got to experience a compassionate use patient. And that, when I saw what happened to her and her story, man, that changed me forever, because I was on a mission to become a galectin evangelist, so to speak, that, hey, this technology needs to see the light of day. So I've been tracking it for a long time. And what happened is probably around 4 years ago, and this is all in the article, about 4 years ago, Galectin Therapeutics came out with some clinical trial results. And truth is, they were phenomenal. But no one seemed to care. Now, it took them forever to get the results, but the results themselves I put them in the article so people can see them. And it showed that in one cohort of patients, 100% of the people had over 30% tumor reduction. And that's the bar for a responder, right? So you had 100% responders rate. So, and a responder classified as a 30% reduction in the primary tumor. So we had these incredible results, but what was more incredible is that they were doing, yes, you see what I'm talking about? That was one of the guys in their cohort of trials. And if you look at like the before and after picture, it's separated, it says day 169. But the thing that this story isn't telling is that they only gave the treatment for like a little less than 90 days, right around there. Don't quote me on it, because it's not my study, but you can see all the tumors resolved if you look in that. Look at the verbiage there. All tumor resolves, and it looks like he has chicken pox or something, and then it's clear. Now they also did the guy did a video on it. So we actually know who this guy was, because you could see the CT scans in the video that match this. So, this was the first great epiphany. Now, what's interesting is they had all this great cancer data, and the company chose to go to liver, and they're still doing something with in cancer. But, these cancer results are amazing. But now the idea is we're going after galectins, right? So they have a galectin antagonist, right? Now, recently, another company came out with their clinical trial results. They have a galectin antagonist called Galecto. And again, these are my competitors. And why on earth am I talking about my competitors? You're going to find out in a second, or when I get to it here shortly. So Galecto, they came out with results, and their results showed within, I believe it was within 3 weeks, they had 60% of the responders rate. 60%. It was in 3 weeks. So they didn't even finish the trial. They have 5 patients, and 3 of them had over 30% tumor shrinkage in 3 weeks. I want you to wrap your head around that and think about, like, wait a second, if you had cancer and you're able to shrink your tumors by 30%, man, you'd probably hold off on surgery for a little bit, wouldn't you? Right? Try to get that mass lower, try to stop it a little bit. So this could change just with these results. I'm looking at going like, wow, this is a game changer in cancer. Now, Galecto, I don't know if they're going to continue to publish these results, but I would expect that they would do like Galectin Therapeutics did and get the 100% responders rate within basically the 3 months time frame. So in a couple months, you might be looking for that too. Now, how on earth does this apply to us, and what drove me to write this article is because in their last press release, they said, hey, we're pivoting. We're not really following up on this too much on this cancer, with this great cancer data, and we're pivoting toward liver. And that's exactly what Galectin Therapeutics did. So I'm looking at this, and I'm sitting out there. I've been waiting all 20 years that I've been following this Galectin Science so that we could come up with a cancer drug. Now, the time that it's taken for these companies to get to this stage, I think we have a better strategy to go after cancer. And our strategy to go after cancer is tackle COVID first, get this drug approved, and then do a label expansion. You see, and that's the idea, and that's my commitment to all these cancer sufferers out there. Is like, who's gonna take leadership in it? Because there's 3 companies that have galectin antagonists. Galectin Therapeutics, and there's more, but I'm just naming the public ones. The Galectin Therapeutics, you have Galecto, and then the third one is my company, Bioxytran. So what we've seen with 2 molecules that are completely different. One's a small molecule, one is a carbohydrate. Ours is definitely different than a Galectin Therapeutics. But you have 3 molecules, 3 galectin antagonists, and the first 2 showed incredible results. So it's really easy to handicap what's going to happen, what our galectin antagonist has a capability of doing in those same disease indications. So that's what gets me excited. Is it's a race to get a drug approved, in my opinion, because galectin antagonists are so big. And I don't know if the other companies share the vision that we have as a company. And the reason we have such a good vision, in my opinion, is due to our leadership. Dr. Platt is the head of our company, and he's the guy that started this whole field of Galectin Science. So he can trace his roots back, almost 30, 40 years ago, because he's the guy who really coined the name Galectin. So anyhow, that's kind of what the article is about, and that's what gets me really excited.
It seems weird to me, and peculiar, like that Galecto would abandon ship when they got the results that they did. I mean, I don't know if I get those results, I'm not stopping. I would go for the full 3 months to see if there's a 100% reduction.
Yeah, I can't speak for the company. You got to go look at the press release. But EROC, what they're doing, or what they said they were going to do, is they said, hey, you know, we're not gonna pursue this particular oncology drug. There's a drug called Tencentric, and there's also a drug called Keytruda. Those are immuno-oncology drugs, right? And then what they're doing is they're pairing it with a galectin antagonist. So Galectin Therapeutics use Keytruda and their galectin antagonist, belapectin, right? And then these guys used Tencentric and their galectin antagonist. That's what Galecto did. But what's interesting is the historical 3-month rate on Galecto's antagonist, or Tencentric rather, alone, without any galectin antagonist, was 10.2% responders rate. Real world data. I like to go off of real world data. And then compare that to what they got in their study, which was 60% responders rate. So you're looking at a drug that makes it like 5 times better. The combination of that drug makes it 5 times better, and they're just, you just got to shrug your shoulders at, the strategy there. But they did say, I'm giving this to them. I'm trying to be fair and balanced here. They did say in their article that they're going to go after Keytruda next year in combination, which is something that Galectin Therapeutics did, because Keytruda seems to have a little bit better responders rate. That definitely in this non-small cell NLCS cancer indication than the Tencentric.
Wow, it's really, honestly, it's mind blowing.
So hopefully what I want people to get out of this is, look, we're not only a COVID company. So I just got to beat in people's heads. We're talking cancer trials take years to do. They're looking at progression-free survival. How long does a COVID study take? What's more cost efficient, doing a 5-day study or doing a couple-year study? I mean,
exactly.
So the idea is, let's just get this molecule approved, and then we do a label expansion. Think about how more receptive cancer patients are going to be to take an approved drug, even if it's for COVID, versus something that's not approved yet. You see, so we by lowering that barrier, we think that's going to help in recruitment. It's going to help in a lot of things, and it's really going to help get what we want, which is we want to get cancer. We want to get this in the hands of cancer patients as soon as humanly possible. They don't have the luxury of time, so time to development is very important. And we think the best strategy to actually tackle cancer is to go after COVID. I know it's a crazy idea, but hopefully the investors follow what we're doing. There's other indications like that. A galectin antagonist is being used in NASH for Galectin Therapeutics, and they're very far along in their clinical trials. And then you also have Galecto. They're going after NASH, and they have a galectin antagonist. The idea is whoever gets to the finish line with the galectin antagonist is going to be able to do massive label expansion. Label expansion, for the viewers that don't know what that means, it means like, hey, once you go after one disease indication, you just keep going. You go like into a phase 2, and you don't have to start all that phase 1.
I wanted to finish up with a question from one of our audience members. Liz did talk about, has there been studies about dog dewormer for cancer? I know of people on it, so I'm not sure of any of the dewormer. I know we heard a lot about that over the last couple of years. Any thoughts on that?
No, it really, I mean, I've heard of people using something called modified citrus pectin. That's garnered like a, you know, kind of a cult following for basically being a galectin antagonist. So that's, you know, that's something that's out there. You know, it'd be really interesting. Uh, Sorry about that. I was just fiddling with the thing here. But yeah, it's really interesting how there's been so many uses of, you know, modified citrus pectin for all sorts of things, including on animals. But I don't know about a dewormer. I think they were using the modified citrus pectin in animals, quite honestly, for tumors, for, you know, to help treating their dogs with tumors. So
very interesting. I just want to give you. You were finishing up. Do you remember the point you were finishing up before? I just want to
no.
make sure that no. All right, it's okay. But
the main thing is, you know, we have a what I want to, I guess the point that we really want to make is that we're not a COVID company. Okay, we're using COVID to get our drug approved. That's it. So I don't care if you think that COVID is going to, you know, come back in a surge or not. We're using COVID as a way to get the drug approved so that we can enhance this platform technology through label expansion. And then you see our market cap is super low, given the fact that we're so close to the pearly gates. The pearly gates being, you know, a phase 3 pivotal study. Now that's in India. I don't want to mislead you. We do have an IND here in the U.S., which allows us to, you know, deliver the goods here, or do the clinical trials here rather. But yeah, that's you know, that I think I covered. I want everyone to go to my LinkedIn. Hopefully, read the article. It's fantastic. If you know, share the article with anyone who's afflicted with cancer. Let them know that this is out there. Maybe we can get a little bit of a cult following on this Galectin Science, because we really need more exposure. Something this powerful. The ability to stop surgeries for cancer, stop the chemo, possibly stop the chemos for cancer, and transition more toward this immuno-oncology. That's a huge paradigm shift. It's here right now. People just have to look at the data.
Right on. Well, I thank you for coming back on, and really, you're welcome anytime to give us an update. Rooting for you guys, and Mike, stay well, sir.
Thank you.